I remain your online doctor, bringing you tips on how to stay healthy and to take care of your health. I welcome you very specially to this year 2024, and I'm trusting that this year we are going to be more circumspect in the things we do that makes for healthy living. So in our last video, I promised I was going to talk to you about conditions that can lead to death, and then these conditions these deaths that can be avoidable. In our last video, I remember we spoke a little about high blood pressure, and then I told you of how we talked about how we could avoid or prevent it, and also how we could treat when we have that condition. So today we're going to talk about a different thing entirely. Diabetes mellitus. Yes, simply, of course, diabetes mellitus is a word that, or a condition that was obtained, or a word that was obtained from the Greek word, which means sweet tasting urine. Yeah, sweet tasting urine, or sugar containing urine. In the past, that's how diabetes used to be diagnosed, but of course science has evolved over the years, and then we have more reliable means of diagnosing the condition. Now, anybody could have diabetes mellitus, but some people are more prone to developing the condition. Now, they are basically, although there are more, two types of diabetes mellitus, called type 1 and type 2 diabetes mellitus. Type 2 is more common, and though type 1 is genetically, although there's a genetic component to type 2, but type 1 is more of completely genetic. But in type 2, in as much as we have the genetic component to it, there's also the lifestyle and behavioral and environmental component to it. What this simply means is that in type 2, the way you live your life, the things you eat, the things you do, can contribute to one developing that condition. But it's not like that in type 1. Okay? Type 1 is purely genetic here, and people can have, because it's actually the result of something called an autoimmune condition, where the body itself destroys the cells that are responsible for insulin production. So the body itself, the soldiers of the body themselves, destroy those cells, and then that leads to the development of diabetes mellitus. But it's not like that in type 2 diabetes mellitus. In fact, in the past, type 1 diabetes mellitus, people used to call it insulin dependent. Insulin dependent diabetes mellitus. That's for type 1, the patient must always need insulin. While type 2 used to be referred to as non-insulin dependent diabetes mellitus, which means that people who have these conditions may not need insulin. But we have come to find out that even those who have type 2 diabetes, eventually at some time in their life, may need or will need insulin. So now we revert, and we are stuck with classifying these two as type 1 and type 2 rather than the previous nomenclature that was used. Now, how does diabetes mellitus occur, or what's the problem when we talk about that? Simply, the problem is about breakdown of carbohydrates, fats, metabolism, even protein metabolism. When we talk about metabolism, we talk about breakdown of food that we eat. Of course, in our elementary days, we know that most of the foods we eat contain carbohydrate, protein, fat. These are basic things that we know. Okay, and these foods, whatever it is, if it's pounded yam, meat, beans, rice, the basic food, salad, whatsoever. All these foods, they contain these compounds. And when we take them into our bodies, right from the time they enter our mouth, the body, there are certain enzymes and other certain enzymes, hormones, and all of that that have been put in place in our body to break down those complex foods to simpler substances that the body can absorb at the level of the intestine. So the breakdown of every food you eat, or most food you eat, begins from your mouth down to the stomach, down to the intestines. They are all manner of structures that are put in place to ensure that this breakdown occurs. So once these compounds that we have taken in food are broken down, when they get to the small intestine or to the intestine, the body begins to absorb them into the blood. Like for carbohydrate foods, they end up being absorbed as glucose. They for proteins, they end up being absorbed as amino acid. For fats, they end up being absorbed as fatty acids and glycerol, and all the big words that are used in medicine. But to simplify this, what this simply means is that for that bolus of food that you take in to be useful in your body, it has to be broken down and absorbed into the blood, and then taken into various parts of your body, either to be used or to be stored for later use at some other time. Now, for when we talk about diabetes, we find that we talk about a defect or an abnormality in this breakdown process as a result of lack of insulin, either total absolute lack or relative lack of insulin. Now, some may be saying, what is insulin? Insulin is a hormone. It's a hormone that's secreted from our pancreas. Yeah, that hormone helps. It's like a vehicle that carries glucose into the various parts of the body, particularly the brain. The brain needs glucose all the time. And even the muscles, even these muscles that I'm using to talk right now, they need glucose. Even the one we use to walk, all the muscles we use to, in fact, the entire coordination of the body needs glucose as its energy to use. And then even there are some other complex processes that are going on in the body that also result in the production of glucose. Now, when insulin is defective, now the use of glucose becomes a problem. How glucose is used becomes a problem. And that is when we say diabetes mellitus have resulted. Now, what happens if glucose is not properly used the way it ought to be used? There are certain things that there are certain manifestations you begin to see in your body. Things like, one begins to wee frequently, you pass urine frequently, you eat because you're passing urine frequently, you begin to thirst frequently. That is, you have need to drink lots of water, even when you have drank water and normally you're supposed to be okay. You need to drink and drink again because the body, you keep passing urine. You understand? And why does this happen? This happens because the presence of glucose, increased glucose in the bloodstream that is not being used up. It increases it increases what is called the osmolarity of the fluid in the body is increased, and then this leads to all the processes that result in, of course, diuresis. The kidney passes urine, the kidney the filtration rate of the kidneys increase and urine is passed all the time and one drinks water all the time. And also because of this, the body is not getting enough energy. There's this tendency for one to eat more than is usual. So there's also the issue of excessive eating. You understand? And then even while one is eating excessively, there's also one could also be losing weight. So these are some of the things people who wake up at night to pass urine often and then pass huge, large volumes of urine. These are symptoms that actually um, could um, could make one think or make one think that, of course, diabetes is present in such a person. So when patients come and they complain, oh, I've been passing excessive urine, I've been drinking too much water, I notice that I get thirsty more than usual, I notice I pass large volume, I'm not gaining weight, you understand, or I'm losing weight. These are indicators that one could be having this condition called diabetes mellitus. Now, this condition called diabetes mellitus is a very terrible one and could actually result in death if it is not properly handled, if it's not properly taken care of. I've seen quite a number of patients who believe that they can do anything, they can eat anything, but as long as they continue to drink bitter leaf water, as long as they continue to drink or take bitter cola or things that are bitter, they cannot develop diabetes mellitus. This is a fallacy. This is an erroneous thinking because it is not correct. And that's why we bring this information to you today. That you don't allow people to tell you, oh, there are some people who go to take yo-yo bitters, they take there are a lot of bitter drinks, they call them bitters, and then they take all these drinks, believing that if they take all these drinks, they can never have diabetes, because if the sugar is high in the body, the bitters are going to neutralize the sugar. But I tell you today, this is not correct. Okay? So in this year 2024, I'd like you to be up on your feet and then look out whenever you have this kind of symptoms. Go for a check immediately. Now, what are the diagnostic criteria for diabetes mellitus? Now, it's simply there's this group of people called the United States Preventive Services Task Force. Now, I like to use their own recommendation for you, my patient, listening to me now. Now, they recommend that for everyone who have attained the age of 40 years to 70 years, it is recommended that they go for regular blood glucose screening. That is, you go to the hospital and say you want to screen for your blood glucose. You want to check if your blood glucose levels are normal. So these people between 40 years and 70 years of age. Now, if anybody falls within this class, it is very important for you to look out for diabetes mellitus. Now, I'm going to come up with a video that's going to tell us. I'm going to look at some of. I'm going to be bringing you tips on screenings, health screenings that you can undertake based on what age you are in currently. But for now, let's talk about diabetes. 40 to 70 years of age, you must do a blood screening for diabetes mellitus. Now, if it happens that your first screening, you come out and your result is fine, it's necessary for you to continue screening every 3 years, like once every 3 years. However, if at your first screening you find that your result is abnormal, there is need for you to see your medical practitioner so that based on what your result or the value of the result is, your practitioner can tell you what to do to prevent progression and also to prevent all the associated morbidities that are associated with this condition. Now, finally, so I can end this video, I want to pregnant women. And pregnant women have also been, I believe, when one is pregnant, there's necessity for such a one to engage or enroll for antenatal care. In the course of antenatal care, pregnant women are also screened for this condition. It has also become noticeable in the world now that even young adults are now beginning to develop this condition. Young adults are now beginning to develop, especially those who are obese. With the kind of food we feed our children with these days, so there's a tendency for children to get obese. You understand? So it's also recommended that those who are obese, then for those who are 40 years to 70 years that I spoke about, okay, I'm going to come there, that even for children who are obese, or for adults, young adults who are obese, even for children, they can be screened for diabetes mellitus. It used to be taught in the past that diabetes mellitus is restricted only to the adults, you understand, or to the elderly, but it has not been found even in children. Not only type 1, because type 1 usually will be present or start at a younger age. But it has also been noted that even type 2 diabetes also have been noted even in younger ages. So it's necessary for us also to watch out the kind of food that we give to our children, and to also give them healthy diet, and also screen them if they are anyone that have become overweight or obese. Then also, we talked about the screening guidelines. For 40 to 70 years adult, it's recommended that you screen. And those people who should screen are those who are overweight and those who are obese. However, those who are not overweight or obese, they can also screen. There's no harm in screening. Then people who have more risk factors, for example, those who have parents who have been diabetic, you understand, or those who have the tendency, you understand, maybe like people who have had diabetes during their pregnancy, gestational diabetes, all these people should screen at a much more earlier age and much frequently. Now, there are lots of things that we can do to prevent progression of diabetes in terms of dietary restrictions or modification, then in terms of exercise that we can also, or physical activity that we can also engage, and also other lifestyle, avoidance of alcohol, avoidance of smoking. You understand? These are things that we can do to avoid or to prevent progression of this condition if it's already present. And also, there is the place of medication. There are lots of medications that we have that if one takes them earlier or starts them earlier, they help to improve the living condition of such a person. So this year 2024, I'd like to advise you to take care of your health. Take care of your health. Yes, if you have a lot to give to the world, so you don't need to die from avoidable deaths. So as we make progress, like I promised you, my next video is going to talk about screenings that you can do as a male, screenings you can do as a female, you understand, and based on what age you are in presently. When that video comes, I'd like you to take cognizance of them, and then use the opportunity to reach out to your medical personnel so that they can run some of these checks for you. Now, someone may ask, when I do a blood check for my blood glucose, what level of blood glucose is abnormal? Now, you can do these blood checks in your house. There are glucometers that are handy that you can actually use in the comfort of your home. Now, if you are someone who is afraid of needles, you cannot prick yourself, then you may go to the hospital or you could go to the hospital. That will help. Now, some of these glucometers or blood glucose check meters, they read blood glucose in various units, but I would like to give you a common unit which you can, and values which you can easily memorize. And that unit I'll be giving you will be unit in milligram per deciliter. Now, if you do a fasting blood glucose, that means you may have fasted from like 8 p.m. in the night of the previous day to 8 a.m. in the morning of the present day. And then if you check your blood glucose level, if it is 126 milligram per dl or above, this is diagnostic of diabetes mellitus. Now, if you don't want to fast, you can just check your blood glucose anyway, anytime. Now, if you check anyway, anytime, and then it reads a value of 200 milligram per dl or more, that's diagnostic of diabetes mellitus. Now, it's also important that when you do these checks, you do a repeat, maybe on a subsequent day, and then a diagnosis can be made at this point. But at this, doing the check at once and making diagnosis may not be altogether very reliable. But if you do a second time and then it is the same, then you may have clinched a diagnosis of diabetes mellitus. Now, there is what they call glycosylated hemoglobin. I would not like us to go there, but a value of 6.5 or greater, 6.5% or greater is also diagnostic. Now, I like you to understand that you should not do all these things all by yourself. It's important that you do this with the help of your medical practitioner. So see a doctor if you have any of these conditions, and see a doctor frequently to safeguard your health. Your health is important to God, for He needs your body to remain His temple. So thank you, and then I'd like you to subscribe to this channel, push the notification button so that when new videos come, you can look at them. You will see them when they come, and then you can view them. And then finally, watch out for our next video. Stay fit, stay well, stay healthy. Bye.